Aloha gang, Dr.Russ Rosen here. Welcome to the OHC System Facebook community. I tried getting this go just a minute ago and it didn't appear that it actually went live. So I'm trying it again. I'm just going to go ahead and check and see if I can actually see that it made it here. And there it is. It's making it this time. Okay, good news. So let me move that over there and this over here and we'll dive right in. Sorry about that, gang. If you happen to be good friends with Zuck, let me know what happened. So, Dr. Russ Rosen, my job is to help natural healthcare providers like you thrive in a care versus care true optimal health model. So your patients get what you do, want what you offer, and happily stay, pay, and refer for a lifetime. And the only way they're going to get what you do and want what you offer is if you can communicate in a way that they actually get it. Now, last week, we went into the neuroscience of communications. Today, we're going to start applying that to the consultation. If you'd like to dive deeper into this work, just put club below. I'll give you a free month into the club. We're here Tuesdays, 1:30 Pacific time, 3 Thursdays a month. And then Thursdays, we're here posting other great information. We're in the club on Thursdays at 11 o'clock Pacific time. Of course, I post all the recordings, but in that one, we're actually in a Zoom room and we're having a discussion. And I don't just lecture at you like I have to on Facebook, but we have a discussion and I draw information out of you and I go quite a bit deeper. So if you find this valuable, if information valuable, please let others know. And let's go ahead and dive in. So when it comes to our patients and being able to communicate with them, again, we're jumping into the consultation. And if you are here, go ahead and say howdy. Let me know where you're watching from. And if you have any questions, let me know when I get done with this. I'll go and I'll check. I'll answer any and all questions. And obviously, if you're watching the recording and you have a question, post it and I will get notified and I'll respond. So what I know is that we really want our patients to get it. We want them to understand what we are trying to tell them, so that they really get what we do, the extreme value of what we do. And many of us just get really frustrated because they don't get it. They don't really see the value of our care. They stop care because they feel better or they don't feel better, but they really don't understand the bigger picture of what's going on. And I can tell you that the solution to this problem is not telling them or educating them or lecturing them. It's not. It just doesn't work. It's actually using the neuroscience of communications. And again, we're going to start right now with the consultation. So just for fun, I asked my friend ChatGPT, I said, tell me a great consultation between a doctor and their patient is crucial for several reasons. And it came up with a lot of information. I'm just boiling that down. It says, to help you get a better accurate diagnosis. Okay, I buy that. An effective treatment plan, or what we might call a care plan. Okay, I buy it. To get patients' trust and comfort. Absolutely. We're going to be talking more about this, but if we don't have their trust, if we don't have rapport, then they can't really buy from us. They can't trust us to follow our recommendations. So far, I'm buying it. It was very interesting because I didn't ask natural health care provider. I didn't ask chiropractor. I just said, doctor, here's what it says. Holistic care. Listen to this. With a great consultation, doctors can address not just the immediate health issues, but also other factors that might affect the patient's health, such as mental health, social circumstances, and preventative care. Are you kidding me? That's exactly what we do. I was so happy to see this, right? In our world, we want patients to understand this. 3 dimensions of stress. This is what causes subluxations, causing your health issues, etc., etc. But my question to you is that your experience when you go see another doctor of any sort? Medical doctor, chiropractor, naturopath, osteopath, acupuncturist, doesn't matter. Is that your experience? Are they really diving in to find out the underlying issues and doing true holistic care? For most of us, the answer is no. How about for you? Is that what you're doing? If not, and you want to, stick around. That's exactly my main focus. Okay? Patient education. Absolutely. We're going to be able to educate our patients, but not by lecturing them. We're going to actually be able to draw their story out of them and apply our story to their story using the neuroscience of communications. It goes undetected under the radar, makes it into the limbic system as a new belief system. Early detection and prevention. Again, I agree 100%. I rarely ever experience this seeing other doctors, but that is what we would like to see have happen. Improved outcomes. Yeah, we would definitely get better outcomes if they understood what we did, if they could stick around long enough to get the results. Reduced errors. I'd agree. Patient satisfaction. Listen to this. When patients feel that their concerns are addressed and they are part of the decision-making process, their satisfaction with the care they received increases. This can lead to better patient-doctor relationships and overall better experiences with the healthcare system. This is huge. Again, is that your experience? For most of us, the answer is no. Is that your patient's experience? Again, for most of us, the answer is no, but we can do something about it. So, if we don't do a great consultation, it can completely blow the relationship. They don't hear a word we have to say and they leave. And the horrible news, other than, you didn't have a patient sign up for care, is they may never get the care that they needed. You may have turned them off to alternative care and they'll never, ever, ever get the care that they needed. So to me, the consult is a really important piece of the puzzle. Now, here are some classic blunders. We try to educate them. We try to lecture them. We talk at them. We rush them because we want to get to what we want to talk about, but they don't feel heard. We let them lead the dance and we never get out of the consult. It goes on for days. We try to use scripts that we learned. The problem is they don't know what the script is. They don't know what their part is. It can feel fake and plastic and robotic. We simply don't have a great template. We don't have a place to move from. In our world, we have templates for everything. These are the series of questions I'm going to ask people to help bring them from where they're at, -10 to 0 to +10. -10 is near death. Most of our patients aren't there, thank God. 0 is comfort. I feel comfortable, but I'm not functioning at my optimum. I'm not healthy. And then there's optimal health. So there's a series of steps that we're going to walk people through. Again, if we don't do it right, it can really push people away, which we don't want to do. So remember from last time we talked about the neuroscience of communications, which is really simple. The reptilian brain for a living is filtering information. It's about survival, food, fighting, and fornication. 92 to 98% of all information coming in never makes it past the reptilian brain. So we never are conscious of it. If it does make it past the reptilian brain, it'll go to the neocortex for thinking, reasoning, and problem solving, which is where we want our information to go. And if it makes sense, it'll drop right into the limbic system as a new belief system. That's what we want, right? But we need to learn how to get our information past their reptilian brain. So we have to quit speaking from our reptilian brain, from our neocortex to their neocortex. That's what we were all taught to do. Mothers, fathers, teachers, preachers have all done that with us. They talk at us. We talk at our patients. If we want to get our information past the reptilian brain, the neocortex, into the limbic system, then we have to learn to speak to their reptilian brain. It's a simple thing. 1, we need to talk about their favorite subject, them. As long as you're talking about them, they're interested. They're engaged, right? Something new, novel, exciting, them. We want to use stories, metaphors, and ask Socratic questions. A Socratic question is where you ask who, what, why, where, when, how, where they have to think, where they literally look up and go, "Arr?" And they go, "Huh." And then they come up with an answer. Then I know it made it here. And if it makes sense, it'll drop into the limbic system. So there are 6 things that need to happen in a great consultation. Step 1, we need to build rapport. And we need to do it right off the bat. I know you've all heard that before, but from the lens of the neuroscience of communications, why do we want to build rapport? Well, if we have rapport and they like us and they trust us, they'll be sending information past the reptilian brain to where? Right, the neocortex. For what? Right, thinking, reasoning, and problem solving. And if it makes sense, it'll drop into the what? Yeah, the limbic system, which is the belief systems where emotions are, where all buying decisions are made. But see, when we meet human beings, we're literally sniffing each other under the table, under the tail, not the table. Unless the dog's under the table, then it's under the table and under the tail. But we're sniffing and we're asking ourselves friend or foe. If it's foe, it goes into fight or flight. That's the amygdala. If it's in the amygdala, fight or flight, it's not getting past the reptilian brain of the neocortex. They're in fight or flight. So we don't want that. So we want to build a relationship. We want to do it very quickly. In my world, it takes 15 seconds. It's very, very quick, but we need to build rapport. Again, I know you've heard it before. I just want to look through the lens of the neuroscience of communications. Now, the next thing we need to do is relieve concerns and fears. Here's my question to you. Has anyone ever come to see you with anxiety or fear? Yes, all the time. She's going to hurt me. He's going to string me along. They're going to cost me a fortune and not help me, blah, blah, blah. Right? So if they're coming in, we've got to do something to reduce that fear so they can hear us. Otherwise, they're stuck in the what? Right, the amygdala. And if they're in the amygdala, are they sending information past the reptilian brain of the neocortex? No, they're not. Okay, now the next thing, and this is a really important piece of the puzzle, is we have to find out why they're really here. And I can promise you that you haven't been taught this unless you've studied my material. I just have never seen it anywhere else. So maybe you have, I haven't seen it anywhere else. And in the club this week, we'll be going into extreme detail of exactly how to do this. But the reality is they are never here because of their pain, ever. They're here because of their loss or potential fear of loss. People are walking around all the time in pain that don't do anything about it. It's when it becomes at a point of loss or potential fear of loss that they finally want to do something about it. So in my world, I need to learn how to find out why are they actually here. Now, the worst question I can ask is, how is this affecting your life? Mostly what you'll get is, or how's it affecting you at work? Oh, I can handle it. Oh, great. Now what? Now where do you go? So we really need to learn how to ask the appropriate questions and get there very quickly. I don't want to spend more than 3 or 4 minutes on this at most, but I need to get to the bullseye of why are they actually here. And a lot of times they don't know why, right? They're in denial. So it's our job to figure that out. Again, if you're interested, put club below. I'll give you a free month. You could jump in. And again, I'll show you exactly how you do this. The next thing you need to do is look at 3 dimensions of stress. Why? Because you and I know that mental, emotional stress, biochemical stress, physical stress are the things that cause subluxations, that cause lesions, that cause congestion of chi. Those are the things that are causing it. And you need to enter the conversation in their mind. See, they could be sitting there going, you're telling them that they may have a subluxation, and they're thinking, I don't remember ever getting bitten by a subluxation dog, so I don't think I have that. So you need to be able to say, look, it's an accumulation of stress over time. No wonder you're in the shape you're in. No wonder you have these subluxations, congestion of chi, whatever it is that you do. Then we need to help them understand that this is classic. How come? Think about it. Why do they need to know that it's classic? So that they know they're in the right place. I see this all the time. Oh, you've got pain here and it goes down your arm? Wow, I've never seen that before. I'm confident we can help though. Right? We don't want to do that. So I need to make it very personal to them. I'm going to be letting them know. Here's how it happened and this is what you're experiencing. That is classic. Right? What I don't want to do is just say, oh, you have neck pain. Well, this is classic. We help people with neck pain. No, you fell out of a cherry tree when you were 8 years old at your grandfather's orchard. And when you hit your head, it caused this and you now have this. And it's been going on your whole life. We see traumatic injuries like falling out of a tree leading to these kinds of subluxations causing this kind of symptom all the time. Look on that chart. Does that look like you? Yeah. Okay, this is classic. And the last piece is hope. Wouldn't it be great? Wouldn't it be great if we can not only do whatever they had hoped for, but if we could also and make the picture bigger? Wouldn't it be great if we could not just get rid of your headaches so you can play tennis again, but if you could resolve this once and for all, if you could resolve this once and for all, by the way, you can get that in the club also, so you can continue to play tennis. Wouldn't that be great? So those are the 6 things that need to happen in the consultation. I need to build rapport, relieve concerns. I need to find out exactly what's going on with them and why they're here. I need to look at the 3 dimensions of stress and anything else you need to talk to them about. I need to help them understand it's classic and offer hope. Now, can you have a CA or staff member do some of the consultation? Absolutely. We have a whole module on that of having our team do the pre-consultation, which saves you a bunch of time and gives the patient a better experience. But it doesn't have to happen. Okay, so I hope you found value. I'm going to go ahead and check and see if anybody has any questions. Right there, it doesn't appear that there's any questions. Good. So if you would like to jump into the club, I'm happy to give you a free month, and you can go. We have all the modules in there already recorded. We have all these kinds of things and these kinds of things that you can download all for free. So I hope you found value. If so, please let other people know. Any questions, you're going to let me know. I will answer them. As always, much love and aloha. Bye, geek.